We've been talking today about hypothermia in babies, when a baby becomes cold. But we also need to be concerned about hyperthermia, when a baby gets too hot. Hyperthermia, or overheating, is defined as a temperature over 37.5 axillary. Some sources even say 37.2 can be dangerous. Some studies have shown that hyperthermia in infants can cause neurological problems in their development. This can happen in normal babies, but is especially dangerous for babies who have had asphyxia or HIE. Extreme overheating can be life-threatening for the baby. If an incubator or an open warmer malfunctions, babies can die. They can also die if they're left in a closed vehicle on a hot day or out in the sunlight. If the temperature goes over 41 degrees axillary, this is extremely dangerous for the baby. The usual causes of overheating in a baby are caused by things outside of the baby's body, external to the child. This can happen if the probe falls off in a servo-controlled incubator or open warmer. Can also be caused by an unmonitored heater or unregulated heater that is put next to the baby, or by phototherapy lights, which often become quite warm. Sunlight, as we mentioned, can also cause this, as can lack of monitoring the baby's temperature if it's warm outside. There are a few causes that are inside the baby's body. This can be fever, or even seizures can often cause overheating. The signs and symptoms we may see in the newborn are sweating, flushing, and fast breathing or tachypnea. These would be if the cause was from outside of the baby's body. If the baby has a fever, such as can happen with sepsis, we actually may see a pale baby. Or we may also see cold hands and cold feet as the fever develops. Both types of overheating can cause tachycardia, a fast heart rate, or irritability in the child. We may see the baby screaming and crying. If it becomes very severe, the baby may stop breathing, having apneas, or he may go into shock, become dehydrated, and have seizures. If the baby has become very overheated, we need to be concerned about treating the baby. So how can we treat hyperthermia? First of all, if the temperature has become over 41, we need to remove the baby from the heater and sponge him with lukewarm, tepid water. This will help to bring the temperature down more rapidly by evaporation. When we put him back in the warmer, we need to make sure that the probe is firmly attached. This should be over the liver on the right upper quadrant of the baby, and that the temperature on the heater should be set at 36.5. Then the heater will not go on until the baby's temperature has become normal. Make sure that your heater is turning off automatically at this temperature of 36.5. Also, you want to remove any excess clothing until the baby's temperature has become normal. Be sure to remove any unmonitored heater or heater without a thermostat. We also want to look for other sources of heat that may have caused this overheating for the baby, such as phototherapy or sunlight coming through a window, and remove the child from these things. We never want to put hot water bottles or hot bricks near a baby, as these are totally unmonitored sources of heat. We want to continue monitoring that baby's temperature until it becomes into a normal range. We should do this every 15 to 30 minutes. Thank you so much for watching this video today on hyperthermia as well as hypothermia. This is called thermoregulation in the newborn. And I'm sure when you put these things into effect in your ward, that you will save many lives by learning these things. Now you can pause the video, and it's time to answer some questions about this last section.